Hi, my name is Bert Lurch of East Central Medical Management, and today we're going to talk about completing a Medicare application and 10 tips in regards to that. So, for our first tip, which starts off right in the beginning of the application, it is Section 1, Basic Information, and this is something that right at the beginning of the Medicare application, it can get really tricky. So this first Medicare identification number area and MPI is only for physician assistants. That's where the information is supposed to go. So do not, unless you're a physician assistant, do not put your information here or the provider who you're credentialing information here, because that will screw up the entire application. The second tip is making sure that you check off a reason for the application. Right here, I checked off that it's going to be a new enrollee in Medicare, and you have to make sure that's checked off. If you send in a Medicare application without any of these reasons checked off, the application will be returned to you. Now we're going to go on to our third tip, which is under the identifying information, which is the country of birth. We get so many calls with practices or people who handle credentialing saying, how come they returned my application because of the country of birth? They could not believe it. The country of birth is very important to be inputted for these Medicare applications. So depending on who is doing the application in the practice, they need to make sure they have the provider's country of birth on it. Number 4, with the certification information, so if the provider is board certified and you put in his or her information here, one of the key things is you need to put the state where it was issued. You need to get that information and complete it, because if not, they will not accept the application, or they will accept it in this case but return it for that information. And you do not want anything to push back a Medicare application, because it could set you back another 90 days. The fifth tip is the new patient status information right here. Don't forget to check off either yes or no if you are accepting new Medicare patients. So we're at the halfway mark with our 10 tips for completing a Medicare 855I. So number 6, which is right here, is the Section 2 identifying information. You have to complete this area before you go on to the rest of the application. So you just answer this question: are you currently in an approved training program as a resident or in a fellowship program? And then if no, go on to Section 2D. So you make sure you complete this area and then follow the directions here. So that's our 6th tip in the Medicare application process. Number 7 is in the identifying information area. And we want to make sure that you must check off 1 for a fact. They need to know what the provider's specialty is. And if the provider has 2 specialties, you need to check off both and put a P for primary and an S for secondary. If you just check off both, they're going to send it back for you to check off or identify which one is the primary specialty and which is the secondary specialty. So moving along, we're going to get to the 8th tip, which is on page 13. So I'm going to scroll through this. And there's some more tips on this, but this is our first one. So we just wanted to give you the easy ones. Number 13 is the final adverse legal actions page. And you have to check off yes or no. So if there's been any claims against the provider, you need to check off yes and then complete the information, or no and skip to section 4. We're almost to the end on our 10 tips. And the 9th tip is page 22, which is the contact person. Now on the contact person page, it's very important. First of all, you have to have this here so that if there's any issue, Medicare can contact you, or if you are contacting Medicare and they need to have the name on file of who they can speak to in regards to this application. So that's very important that this must be filled out. But the real tip on this is if you're in an organization that has multiple people handling the applications, or maybe it's an office manager and a credentialing person, you can make a copy of this form and send it in more than one page of this form so you can have more than one contact person. So that's something that works out really well. You may have a person that works in your organization that leaves, and now you have a problem because the contact person is the person who no longer works there. So the ninth tip is the contact person form, and you want to make sure that if you have more than one person that may be involved with this process, that you complete more than one of these forms. And the last, most important, but not, we don't want to forget it, is the Section 15 certification statement. Many times applications are filled out, double check, triple check, but the provider doesn't sign it. That application is getting returned. So please make sure that you have the application signed here in Section 15 in order for the Medicare to handle it appropriately. If you have any questions in regards to the credentialing process for providers with Medicare, 855Is, 855Bs, etc., please feel free to contact us on the web. It's www.ecmmgt.com, and we would be willing to help you out with that. Thanks.